We'll talk a little bit more about blepharoplasties during this video. What is blepharoplasty? Blepharoplasty is when we remove excess skin or excess fat or both around the eyes. When we talk about upper blepharoplasty, that's the skin right above your eyelid. A lot of times as we get older, and sometimes it's genetic, that we just made that way, we have extra skin that will kind of be hooded over your eyelid. And in some people it can get pretty bad where it actually impairs their vision. It comes down really low and actually gets below their lash line, and then it's very hard to see sometimes, especially to the side. So, and of course it's heavy. For most people that would do blepharoplasty, especially surgical blepharoplasty like this, a lot of women and men too, but women especially, we start noticing it a lot of times after Botox, but also just on regular day when we're trying to put makeup on. It's hard to put that eyeliner in if you have that hooded eyelid, and especially as you get older and it gets heavier, then even if you put eyeliner on by pulling your eyelid away, once you let it go, well, it falls back and nobody can see your eyeliner, nobody can see your eyeshadow. And it also makes us look a little bit tired. So by opening up that eyelid, by taking off that extra piece of skin falling on your eyelashes or close to it, we do open up your eyes, we give you that more rested quality and rested look. And of course, for people who have trouble seeing because of it, that's an extra benefit, of course, that you can now see better. That surgery can be done awake under local anesthesia, or you can have some sedation. It's pretty quick and pretty quick recovery. So it can cause some swelling, because anytime we do surgery around the eyelid, we inject numbing medicine in there, the tissue is very sensitive, so it definitely can cause some swelling afterwards. So you don't want to do surgical blepharoplasty or non-surgical blepharoplasty for at least a couple weeks before any event. I would usually say 1 month would be safest. Lower blepharoplasty, that's when we get that bag under the eye. And in some people, it's just skin, right? We get crinkly, kind of old looking skin right under the eye. But for some people, it's actually fat that's protruding from underneath the eye, and it goes in 3 little compartments right here. So it starts to bulge out here. And the way to remove that fat is actually make a little incision, usually inside your eyelash line, and go into those little compartments and take out very carefully that fat, that 3 little pieces of fat right through here. And then the skin usually lays down very nicely. In some people, they still need a little procedure to either remove excess skin or shrink excess skin. There are different ways of doing it, and that will depend on your skin type and your desires and technology that's available to the doctor. So there's different ways to do that. So same thing, several weeks of recovery, several weeks of potential swelling underneath the eye, but eventually when swelling comes down, that area becomes nice and smooth. Of course, we don't want to overdo it, because we don't want to hollow out your eye and make it look like there's a very really deep tear trough. Other options would be non-surgical blepharoplasty, and that's acutite. That's radiofrequency procedure that's done in the office under local anesthesia, and we're basically going through a little tiny needle hole and go underneath your eye or above your eye, and we shrink the tissue. That happens over time. Again, the non-surgical blepharoplasty, the shrinkage happens over a period of several months, and up to a year continues to shrink, and we get better and better result. And so again, not going to give you exactly same surgical result, but it will give you enough to make a difference. So again, depends on how much extra skin you have, we can decide which way is better for you. I love to combine my upper blepharoplasties with a little bit of a brow lift in the non-surgical acutite way, because by lifting up that brow just a little bit, it will open up this space as well and give you slightly younger appearance. And combining all 3, and some people they need that, will sometimes take at least 10 years off your appearance. Learn more about those procedures online. You can ask me more questions on Instagram, Facebook, or YouTube.